So how different is it going to just a family practitioner to coming here? What will they get at Jacksonville Wellness that maybe the just regular family practice doctor doesn't focus on?
Okay, so we're really kind of comparing apples to oranges.
Okay.
So as I said, I did my training as a nurse practitioner to do family practice, meaning,
Mhm.
you know, I could see all ages and help with common diagnosis and routine health care and things like that. So the apples and oranges of it would be maybe someone has a very complex problem and they're going to need more, number one, more of my time. You know, when I see people, I spend an hour with them. You know, I say, tell me your story, you know, tell me what you think's going on, tell me the stress in your life, tell me your nutrition. Like, I want to be the specialist that puts it all together.
Mm-hmm.
So in that aspect, you're really comparing two different things. So I consider myself a wellness specialist. So I like to get any lab work from family practice or any specialist that they've seen. I love to look at those labs first, and then I like to add things like micronutrients and amino acids, and look at maybe toxins, and, you know, try to put it all together to piece together maybe that part that hasn't been seen, or even that part that hasn't been heard. You know,
Mm-hmm.
I feel like being a nurse for 20 years, I feel like I'm a good listener. I love to teach, so people come from, when they see me, they usually get a plan, you know, like, have you ever thought about eating more avocados, and, you know, a plan of that, and then have you ever thought about, you know, reading this book on this or that, and, you know, let's work on this, and then I'll see you in a month, and just to continue to work on all the body systems actually work together. So
Mhm.
help people who are maybe having an adjustment disorder and going through a stressful time, and they can't sleep, or you know, they've worked out too hard and they're having a pain, or they're an athlete and they're trying to train for something, or they need to lose weight and they need to eat healthy fats, or one of the things I love to help people with is if they have an autoimmune disease, and there's not a whole lot of help out there for that to actually, because we can't change the genetics,
Mm-hmm.
but we can help your quality of life, because you're going to live with something like MS or Hashimoto's thyroiditis for your life, but I can help you manage that with stress and nutrition. And again, one of my slogans is "Be well." You know, my joy is to get people to feel better
Yeah.
overall.
You're like a medical detective almost.
I think I'm like Dr. House, but I don't have any. I don't have a narcotic addiction.
Okay.
So yeah,
Well,
kind
good.
of like
Yeah,
him.
that's good.
Yeah. When I was a child, I loved to put, you know, the large puzzles together. You know,
Yeah.
Jeff, when we were little, we didn't have YouTube and all this stuff
Right.
and cell phones. So we would like play with our friends outside or actually do stuff. And so me and my friends, we would love to put together like 2,000 piece puzzles. And I
Wow.
feel like that's what my practice is. Like, I just
Yeah,
want to
putting
find that point that no one else can, and just to see the joy. You know, I want my patients to feel better and maybe hopefully not have a crisis and see me again, but I want to get them to the point where they're doing the self-care versus I have a symptom, I'm putting a Band-Aid on it. That's wonderful if you get hit by a car and needed to go to the emergency room and have that symptomatic care, but I like to get to the root cause of symptoms to really help people maybe feel better. Maybe they could lose the weight or get under less stress and need less medicine. Like, I really enjoy seeing my patients do well.
That's awesome.